Hello and welcome to our show, Health and Wellness, Myths and versus Facts. I'm Gargi Rawat. The endocrine system is a network of glands that produce and release hormones, and these hormones are responsible for various functions in the body, from heartbeat to tissue growth to the creation of new life. Diabetes mellitus is one of the most common endocrine disorders that affect the body's ability to produce or use insulin. Worldwide, 537 million adults are currently living with diabetes. The number of people with diabetes in India is the second highest in the world, and early onset of diabetes, which is an issue in India, increases the risk of associated complications. Education is one of the most important components to ensure better management and control of diabetes. Now, there are many misconceptions about diabetes prevention and management, and it's only by raising awareness that we can help everyone else to understand what we live with. In this program, experts provide medically accurate and actionable advice on preventing diabetes and help viewers identify strategies for long-term control. Let's go across to our panel of doctors. We're joined by Dr. Arun Kannan, endocrinologist and diabetologist, Madurai City Hospital, Dr. Jugal Gada, consultant endocrinologist, Hormone Encore Clinic, Mumbai, and Dr. Vahid Bharmal, consultant endocrinologist, Bagh Hospital, Vadodara. Thank you so much, doctors, for taking out time to talk to us and answer all the questions. And Dr. Gada now, and if you could tell us which are the different types of diabetes, and can all types of diabetes be prevented?
So basically, we classify diabetes as type 1 diabetes, type 2 diabetes, gestational diabetes, and other specific forms of diabetes. Type 1 diabetes is usually seen in children and young adults. That usually happens because of an autoimmune process. That is, your own immune system makes certain antibodies that damages the insulin producing cells of your body. And hence there is a lack or insulin deficiency, and hence you get into diabetes. Type 2 diabetes is what is most common, as you were saying before, and this is something that you will be seeing in your neighborhood and in your family and friends. The background of type 2 diabetes starts with insulin resistance, where your insulin that is produced is not being able to function appropriately. That is pushing the sugar from the blood in the cells. After the insulin resistance progresses towards a point of time, you get into insulin deficiencies and your beta cells start producing lesser insulin. The background of insulin resistance is all due to lifestyle and obesity most of the time. Gestational diabetes is the one that you see in pregnancy, which happens after around 20 to 24 weeks of pregnancy, which is a combination of insulin resistance, hormonal changes in pregnancy, and to a good extent, even the insulin release. Other specific forms of diabetes that I was mentioning are pancreatic diabetes, where the pancreas gets damaged or inflamed because of an infection, and hence the insulin producing cells no longer function well and the insulin production goes down. Then there are certain genetic forms of diabetes, though rare, but we do see them as well. One of the most common ones is MODY, that is maturity onset diabetes of the young, which is very much familial, and it presents at a very young age at around 20s and 30s, runs in the families, and it is all because of the insulin signaling defect that these patients get into. Coming to the prevention part of the story, as you mentioned, besides type 2 diabetes and to a good extent gestational diabetes, the other diabetic forms are not preventable. So for type 2 diabetes and gestational, having appropriate lifestyle measures and weight is the most important part of the story for prevention. And the last and final thing, all these types also have a little gray in them. So the classification is not that straightforward, because especially with the rising pediatric obesity that we see now type 2 diabetics coming even at as early as at 14 and 16.
All right, so that's very worrying, these trends of early diabetes. Dr. Bharmal, if you can tell us, we've often heard that early detection of diabetes helps to manage the condition better, but many people with type 2 diabetes may have no symptoms, and in the absence of symptoms, when should people consider screening for diabetes?
Yes, you have rightly said that many type 2 diabetic mellitus patients are asymptomatic, and sometimes they are diagnosed when some complications because of diabetes have developed. And more younger people are diagnosed with diabetes mellitus. As doctor has said that we can see type 2 diabetes mellitus in the younger age, around 14 to 16 years of age. So screening should be recommended for every individual who is more than 30 years of age, irrespective of risk factors. And whenever there is risk factors are there, like obesity, sedentary lifestyle, women with history of gestational diabetes mellitus, or women with polycystic ovary disease, or when individual have other illnesses like hypertension or cardiovascular disease, or having family history like first degree relatives with diabetes mellitus, they should be screened for diabetes at earlier age, means before 30 years of age. And screening is very important for early diagnosis of diabetes and as well as for diagnosis of pre-diabetes. And that is very important. If we can diagnose pre-diabetes, that is the stage before diabetes, we can prevent diabetes or delay diabetes. So screening is very essential. As far as our country is concerned, we are seeing very many individuals who are developing diabetes at younger age.
All right, Dr. Gada, how does this excess sugar in blood cause damage to the body, and why is it essential to control this?
Having high sugars for a long period of time basically affects all our organs, including the heart, the kidney, the eyes, and the nerves, as well as the brain. So in the kidney, you basically have kidney failure. In the eyes, you may have retinopathy, which leads to vision loss. In the nerves, you have neuropathy. And in the brain, you lead to brain strokes. And that is the central reason why you should keep your diabetes under control, because these complications are really devastating and obviously even sometimes life-taking. Coming to the reason why these happen, if you have high sugars for a very long period of time, the high sugar slowly affects the blood vessels which supply these organs. So all the organs receive a lot of blood through which the nutrients come in. Once these blood supplies get affected to these organs, the organ function starts getting compromised. Like in the heart, if the blood vessels are choked up, you get a heart attack. In the brain, you will get a brain stroke. In the nerves, you get neuropathy, where the sensations of the foot start dying down. And hence, keeping a sugar control is imperative to prevent all these complications.
All right. Now, Dr. Bharmal, if you could tell us, the key to diabetes management is to keep a check on blood sugar, as it's just been explained, and keep it under control. So, what is an extended version of the ABCs of diabetes?
So, extended version of ABCs are the parameters for comprehensive diabetes care. And that is the small mnemonic that should be remembered by patient and clinician, for clinician also. So in which A means A1C, that HbA1c, that's 3 months average blood glucose level, should be less than 7%. Then for your fasting blood sugar between 90 to 130, and post-meal 2 or post-meal blood sugar should be less than 180. Then B means blood pressure. Every diabetic patient should have blood pressure less than 130 by 80 millimeter of mercury. Then C means cholesterol level. The LDL cholesterol level, that is bad cholesterol, should be less than 100, and who have heart disease, it should be less than 70. Then triglyceride level, it should be less than 150. Then HDL cholesterol level, it should be more than 40 for men and more than 50 for women. Then D means D means diabetes education. Every diabetic patient should be aware of their goals, their diet, which type of exercise they should do, complications of diabetes, and what care they should take to prevent these complications. So diabetes education is integral part of comprehensive diabetes care. Then E means eye examination. As discussed, that diabetic patients have increased risk of retinopathy. So every diabetic patient, type 2 diabetes patients, should be screened for retinopathy at the time of diagnosis of diabetes, and type 1 diabetes mellitus patient should be screened within 5 years of diagnosis of diabetes. Then F is foot examination. As diabetic patients are prone to develop diabetic neuropathy and peripheral vascular disease, they are at risk of ulcerations and subsequently amputations. So they should be screened annually for their foot, for their sensations, whether they are developing any neuropathy or not, and for the pulses, whether they are developing any peripheral vascular disease or not. So we can prevent the complications that is arising because of neuropathy and peripheral vascular disease. Then G means glucose monitoring. Glucose monitoring by self-monitoring of blood glucose, that is by glucometer. That is very essential part in patients who are taking insulin, and they need to do 3 to 4 times in a day at least. And for patients who are taking medicines, they can also do once weekly or fortnightly. Then health maintenance, because diabetic patients are at increased risk of infections. So some immunization is necessary, like for influenza and pneumococcal pneumonia, for prevention of these infections as per guidelines. And I means indications for specialty care. Sometimes diabetic patients require management from expert in diabetes, and sometimes they may need referral when they develop complications like diabetic nephropathy, that is kidney damage, diabetic retinopathy, and cardiovascular disease. They may need referral to nephrologist or retina specialist or cardiologist. So this is the all elements are for comprehensive diabetes care.
All right. Well, let's now go across to Dr. Kannan. And Dr. Kannan, if you could tell us, there are some misconceptions regarding the levels of blood sugars that can diagnose diabetes. Which parameters need to be checked before confirming that a person has diabetes?
Various, because it's very important to diagnose a patient with diabetes. So the management can be very well managed. So the more important for the sugars in the blood glucose has to be, and there are 3 ways by which we can diagnose diabetes. The first is the patient should have a good fasting plasma glucose. When the fasting plasma glucose is more than 126 or greater than 126 milligram per deciliter, then it's a diabetes. Diabetes is diagnosed and confirmed. Or we can go for a glycosylated hemoglobin, that is HbA1c. When it is more than 6.5%, then it is a diagnosis diabetes. Or it can be a oral glucose tolerance test by giving 75 milligrams of glucose and checking the blood glucose after 2 hours after glucose. When the blood sugar is more than 200 milligrams, then it is a diabetes. So there are 3 ways by which we can confirm the diagnosis of diabetes, and very much we have to have a good criteria for diagnosing diabetes. That is, fasting is 126 milligram, the A1C sugar is 6.5%, and when you give a oral glucose tolerance test by giving 75 milligrams of glucose and checking the sugar about after 2 hours, when the sugars are more than 200 milligrams, then its diabetes is confirmed. And also maybe we can, if you want to, when you are busy clinic, when the patient comes with a lot of symptoms like weight loss or increased thirst or increased urination, then you can do a random blood sugar, and the blood sugar is more than 200 milligrams per deciliter, then it is a diabetes also confirmed, and the diagnosis of diabetes is very well established. So this is very much important to diagnosing diabetes, and also the management is based on this values. So that way you can go for a further management. Before that, a lot of other myths are there. But you can check your blood sugar. Yeah.
All right, we'll just slip into a short break now, and we have more questions for the doctors. We're discussing diabetes. Do stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about diabetes. Let's go across to our panel of doctors. And Dr. Gada, what are the benefits of exercise for people with diabetes, and what precautions should be taken before starting an exercise regimen?
So exercise has multiple benefits. First, the short-term benefits or the acute benefits that you'll see. One is in the improvement of the sugar levels, obviously. You have improvement in your blood pressure levels as well. You have improvement in your mood, decrease in anxiety, and a good quality of sleep. In the long run, definitely there is good weight management. It prevents your chances of cardiovascular, that is your heart attacks and brain strokes. It even improves your bone health by improving the muscle and the bone quality and decreases your chances of osteoporosis, improves your memory and decreases dementia, and last but not the least, decreases falls, especially in the elderly, because they are more prone to imbalances, and exercise improves that balance part of the story as well. Coming to the precautions, so most of the time we always individualize a plan for our diabetic patients, because each diabetic patient is different in terms of its medications, that is the drugs that he's on insulin, the comorbid conditions, that is he's having a heart issue, a kidney issue, or a stroke, or any other like uncontrolled blood pressure or a neuropathy. For example, if you have a heart disorder or uncontrolled blood pressure and you start having very strenuous exercises, it can be detrimental. We do have simple do's and don'ts, like, if you wear a good pair of shoes and socks, which are very important, even if you don't have a neuropathy, can prevent simple injuries in a diabetics. We even need to understand about hypoglycemia, that is low blood sugar that can occur during or even after exercises. Hence, we always educate our patients regarding the same. A simple rule could be, if your sugars are less than 100 when you start the exercises, always eat something before you start exercising. And the last thing is, always gradually get into your workouts. If you've not been working out every week, increase it by 10% each, so that you don't have muscle injuries or other injuries as well.
All right. Dr. Kannan, a healthy diet is a key for managing diabetes well. We just spoke about exercise. What type of diet should a person with diabetes follow?
The first and more important part in diabetes management is diet. That is a medical nutrition therapy. First, you have to assess the patient body mass index, whether the patient is obese or not. And also, we have to find out whether the patient is taking calories, how much calories he is taking, and out of which what is the amount of carbohydrate he is taking, and also the protein in the diet, and also the fat in the diet. Also the macronutrients and other fibers, which is very important in diabetic patient, should be taken into counseling, and have a very balanced diet is very much important. Next is the first is the carbohydrate counting, or how much the carbohydrate the patient is taking. You have to assess by using a very well established diet calculator, whereby the amount of carbohydrate can be measured, and depending upon the increased carbohydrate intake, we have to reduce the carbohydrate intake to less than 50 to 60%, especially in South Indian patients or the Indian patients. That is increased carbohydrate intake is very much seen in a diabetic patient, which is seen in the Indian population. And also the next is the protein, which is one of the important part in the diet in a diabetic patient. Should be kept in a normal protein, that is around 4 to 6 grams per day, or 0.1 milligrams per body weight in diet. And the more important diet protein is a lot of other legumes, and sometimes the patient can take a non-vegetarian diet like fishes and eggs. So it's very important. And also the fat can be in a moderate quantity. You have to assess the patient whether the patient is having a diabetic-related cardiovascular problems. Then we can start with the fat can be taken. And also the more important is the fiber, which is very helps in the managing the diabetes in a diet. That is by reducing the glucose levels. You have a good fiber diet, like by taking a lot of vegetables, lot of legumes, and various. Sometimes fruits can also be helpful in having a fiber diet. And it should be a very balanced diet, depending upon the individual patients. You can't have a diet for everybody. You can take the diet saying that this patient has to be very well tailor. I mean, you can't give a diet for all the patient, all the diet. So we have to very much see whether the patient is having a cardiovascular problem. The diet should be different from the diabetic patient with the cardiovascular problem, or whether the patient is having a diabetes-related kidney problems. Then you have to the diet is very much different. So depending upon the patient, the diet is very important.
Dr. Kannan, having a silent heart attack puts you at greater risk of having another heart attack, which could be deadly. Why do people with diabetes experience silent heart attacks?
The more important problem in diabetes patient, the silent.
All right, Dr. Gada, final question to you. It's a common myth that only overweight individuals will develop diabetes. Are skinny people also immune to type 2 diabetes?
No, so skinny outside doesn't mean skinny inside. What it actually means is we have a lot of visceral adiposity as Indians. That is the organs, the internal organs around which there is a lot of fat. So for the same BMI in the West, that is the Americans or the Caucasians, we have higher visceral adiposity, that is more fat around our organs, which makes us prone towards more insulin resistance and getting into early diabetes that way. And hence we call this as the thin fat Indian phenotype, where for the lower BMIs also we get into diabetes faster. And hence we have our own BMI cutoff for obese and overweight that you see, like 23 is the overweight cutoff for the Indians and 25 for the obesity, whereas in the West it is 25 and 30 respectively for them. So being skinny does not mean that you do not have a chance of becoming diabetes. So your lifestyle is of utmost important in prevention of diabetes.
All right. Well, thank you so much, Doctor, for joining us and answering all those questions about diabetes. Now, going back to Dr. Kannan, if you could, answer that question about silent heart attacks and why our diabetic people, experience these silent heart attacks.
The diabetes is a condition which all the nerves in the body are very much affected, especially the autonomic nervous system. Because of the nerves which is affected by diabetes, there is a pain in the nerve which is connecting the heart. It's very much affected. That way the pain during any cardiac problem, especially the heartache or the myocardial infarction or any ischemia, the pain is not very well felt by the diabetic patient because of the autonomic nervous system affected, because the nerves are very much affected. It's because of diabetes, and most of the patient, especially the diabetic patient who go for a sudden cardiac death because of myocardial infarction, the patient never felt any pain in the chest. So it's very important to assess all the diabetic patient to look for any cardiovascular complications or any cardiovascular problems in the diabetic patient, because the patient won't say that I have a chest pain, thereby saying that we can assess the patient. So all the diabetic patient has to be very well assess the cardiac status during the regular follow-up for a diabetic patient. So it is the nerves, the autonomic nervous system, which is very much affected in a diabetic patient. That's why the patient doesn't have a feeling of pain.
Thank you so much, Doctor, for joining us and answering all those questions. And I hope that was very helpful for our viewers, as there's clearly a need for more awareness around the issue of diabetes and how many young people are also, susceptible to diabetes. Thanks for watching at home. Goodbye.